I'm Dr. Nagaraju, working as a senior specialist in steel plant, Visaka Steel Plant General Hospital. Present topic is latest updates in hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to coronary vascular disease, which affects 45% people in the 40 to 60 age group. Raised blood pressure is among the most important risk factor for cardiovascular diseases. It remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. In India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, 29% and 28% respectively. Despite that, nearly half of the people, or 51% of men and 41% of the women with hypertension, were unaware of the condition. Accordingly, over 62% of the men and more than 53% of the women living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. International Society of Hypertension has released the ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempts to address the issue that in resource poor settings. Optimal care refers to evidence-based standard of care, and whereas essential standards refers to minimum standards of care to allow specification of essential standards of care for low resource settings. The American College of Cardiology has released a scientific statement in 2021 offering new guidelines for management of stage 1 hypertension among people with low atherosclerotic cardiovascular diseases risk. Among low risk adults, management starts with non-pharmacological therapy. If blood pressure remains uncontrolled 3 to 6 months, consider among starting pharmacological therapy. Acute respiratory distress syndrome is a potentially fatal condition involving lung damage, and experts often associate it with severe COVID-19. A recent study, which appears in the Journal of the American College of Cardiology, reports that metoprolol can reduce lung inflammation and improves respiratory function in people with COVID-19 induces ARDS. With regards to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, 2018 European guidelines on the management of arterial hypertension recommended that the diagnosis of hypertension should not only be dependent on office blood pressure management, out of office management, or home blood pressure monitoring. 24 hours and nighttime BP measurements were associated with greater risk of mortality and a composite of CV outcome. Thus, they may be considered as the most relevant measurement of estimating CV risk. For every 20 by 10 mmHg increment of blood pressure measured at night, the risk of mortality increased by 23% of the risk of cardiovascular events by 36%. Most patients with hypertension requires lifelong medical therapy to achieve optimal blood pressure. The 2018 European guidelines equally recommended 5 classes of antihypertensive drugs, considering high non-adherence treatment. The importance of combination therapy is particularly highlighted to improve adherence to therapy and BP control. Therefore, the 2018 European guidelines recommended, especially in the context of low BP targets, to start antihypertensive therapy with an initial dual fixed dose combination of ACE1 or ARBs or plus calcium channel blockers or the diuretics. Since early 2018, products containing valsartan have been recalled worldwide. The reason is the detection of a known carcinogen, namely N-nitrosodium-methylaminase, which can be found in irbesartan, losartan, olmesartan, and valsartan. NDMA has been classified by the WHO International Agency for Research on Cancer to be carcinogenic in humans. 1 lakh patients would have been received NDMA contaminated valsartan every day for 6 years in the highest dose. It could result in 22 additional liver cancers over the lifetime of these patients. The presence of NDA in these drugs could lead to 8 additional cancer cases in 1 lakh patients if they had taken the highest daily dose over 4 years. Valsartan recall accompanied by a significant increase in the rate of emergency department visits of 6%. The Hyga study represents the largest study that tested nighttime antihypertensive treatment. In this trial, chemotherapy was associated with a significant reduction in endpoints. The Hyga chronotherapy trial tested whether nighttime therapy is in comparison to usual upon awakening hypertension therapy exerts a favorable CV risk reduction. The largest study includes a total of 19,084 hypertensive patients during an average follow-up of 6.3 years. 1,752 participants experienced the primary CV outcome, and ambulatory blood pressure monitoring was performed for 48 hours to collect data on low BP deferred during sleep. The RR reduction for CV events was significantly improved for nighttime treatment when compared with awakening treatment. Thank you.